Hi, everyone. Let me go through the questions, answers, and rationale for the two practice exam questions in our healthcare ethics class. This is how I'm going to summarize all the exams just through this YouTube video. It's just a lot easier. It stays up on the Blackboard site. You can watch it as many times as you need to. Okay, so let me just say a few things. You need to have your stuff with you, your laptop, your notes, and it'll become a little bit more clear as you get down to the rationale. So uh, I'm not going to read this entire question, but you get a sense. This is a fairly long question, but they're all cases. They won't all be this long, but this has to do with Thomas, who's admitted to the hospital. And you can see in the first paragraph, it talks about his medical issues. But this is really about the admission paperwork. And this has to do with autonomy and consent. Um, so, what is clear as you go through this that he and his sister, or at least his sister, is assuming sort of responsibility and becoming his voice. And that's the notion of a surrogate decision maker. We haven't quite spent time talking about that. We will later on. But a surrogate is someone who is a substitute, who is their voice, especially when they can't speak for themselves. But as you sort of go through here, um, even though Thomas has these medical issues, and of course he has ALS, Lou Gehrig's disease, the psychiatric consult confirms that Thomas understands his diagnosis and prognosis and can make informed decisions about his care. But his sister essentially is saying, no, you don't need the medication. The question then is over here. If pain medications are administered, whose autonomy is being respected? And so your task here is to not only choose a response, A, B, C, or D, but put the ethics rationale in here. Keyword is ethics. You have to be able to connect it to ethics themes and content in our course. And my advice will always be the more examples you can give, or an example, the better. Now, you don't have a lot of space. So, if pain medication is being administered, which is what Thomas is asking for, he wants medication, he's mentioned that to the nursing staff, then clearly it's Thomas's autonomy that's being respected. It's not Thomas and his sister. It's not his sister's autonomy. It's not the physician. So respect for Thomas's autonomy. Okay, so that gives you 1 point. What's the rationale? Um, and so you have to go back and use stuff. Not just Thomas can make decisions on his own, but Thomas is able to understand um, and make informed decisions after the doctor's consult. But the key thing here is even though he has these medical issues, he also has agency, okay, which is a term, because we know we're respecting his autonomy. He is informed and he is consenting. Now, you don't have to put all of that in, but these things, which you know because it's in your notes, have to appear in here. And if they don't, then it's going to be much more challenging to for you to come up with a rationale. Use the terms. Use the terms. Now, um, it also helps if you can use an example, and those examples come from anything we've covered. It could come from the documentary Wit. Could come from a reading. It could from an example in class. Now, this case you haven't seen before, but you could say, in Wit, Vivian chose to be DNR, even though her medical issues were unfortunately progressing in a downward slope. She still had the ability, because she was informed. She had the ability right then with Susie to make that decision. That's agency, and she consented. Or in her case, she said, no, I don't want it. That's an example. Okay, let's keep going to the second question, which has to do with keepers of the house. Keepers of the house, the key question, what's the primary lesson learned from the documentary? You are focused on the ethics part. Now, I want to just go through these responses. Housekeepers are among the lowest paid employees at a hospital, but might interact more with patients than a clinician. This, at least from our discussion, is true. Okay. Housekeepers are skilled at noticing, which allows them to make important interventions for patients and family. You know what? That's also true. The majority of housekeepers are women and are racial ethnic minorities. Well, at least in the documentary, that's true. Okay, so we have three potential answers, and they're all incorrect. What is the correct answer? The primary lesson learned from the documentary focusing on the ethics issue has to do with this, and it comes from this empathetic awareness. Now, in our class, we talked about emotional intelligence. We spoke about empathy. We actually, that was one of the words that I believe was on the whiteboard wall. It's in your notes. And so that is one of the words that you came up with. What are a couple words that highlights your experience here? Now, you have to define this. What does this mean? Well, empathy is listening, really good listening. You might say more than that, but you could also bring up the emotional intelligence stuff. So you're bringing in stuff that we've talked about. And an example, I mean, you can use an example from Keepers of the House. My favorite examples all are about food. And there were a couple examples where the housekeepers gave food to patients who asked for it. Hilda, our favorite and oldest housekeeper, sat with one of the patients who also happens to be an inmate, a prisoner, and held his hand. The examples really matter because that demonstrates this. All right, folks. So, just a sense of how to approach this. Both the responses are important to dissect, but the rationale is much more important. All right. Thanks very much. Bye.